A report came out of the federal government this week about the solvency of the federal Medicare trust fund. Now, you may have missed the report because it was fighting for airtime in a news cycle that was clouded by two much bigger issues. Where's Melania Trump and why haven't we seen her for a month? And will Dennis Rodman attend the North Korean summit with the president? But if you waded through those issues like me and got to this report, you received some pretty staggering news. The federal government is now predicting that the Medicare trust fund will become insolvent in 8 years, 2026. If you're keeping score along with me, that's 3 years sooner than the last report just last year. Now, before we deal with the insanity that is the Medicare trust fund, let's take a look at what happened when the news was released. Every year when this report comes out, somebody stands at a podium and behind him are several cabinet secretaries, Labor, Health and Human Services, Treasury, and the Social Security Administrator. The individual issues the report, and then those cabinet secretaries take questions from the media. This year, there was nobody standing behind the guy who issued the report. All of the cabinet secretaries were gone. Why were they not there? Scheduling conflicts. Yep, scheduling conflicts. Seriously. A report's being issued about the largest single line item in the federal budget going bankrupt in less than a decade, and they had scheduling conflicts. Now, call me skeptical, but I don't really think those were scheduling conflicts. To me, a much more likely scenario is each one of those individuals was curled up in the fetal position under their desk, screaming to their secretary that they weren't taking any calls today, because nobody wanted to take questions about this. Now, while nobody would take actual questions, somebody had to issue a statement. We just can't go without a statement from somebody. This year's loser was Steve Mnuchin, Secretary of the Treasury. He drew the short straw. He had to try to put a happy face on some pretty bad news. So what did Steve say? Well, Steve said that he felt like the program was solid and would be able to meet its obligations to its recipients well into the next decade. Really, Steve? The next decade starts in 18 months. Can you imagine for a minute if doctors dealt with information that way, had difficult discussions like politicians do? Mr. Harrigan, while it's true you had a mild heart attack, I feel very confident that your health is solid and you'll be able to live well into the next decade. Excuse me, Doc? The next decade starts in 18 months. I have small children. No, that's not the way the conversation happens when a doctor's involved. The way it happens when a doctor's involved is this. Mr. Harrigan, you had a mild heart attack. The first thing we're going to do is schedule you for a cardiac catheterization to see if there's any damage and anything we need to do immediately. If that comes out clean, we're going to put you on medication to reduce your cholesterol and lower the risk of a future heart attack. And then we're going to start working on long-term solutions about diet and exercise to improve your health so you can live well beyond the next decade or the decade after that. How do I know that that's how those conversations go? Because that's how it happened with me 18 months ago when I had my heart attack. And that's exactly what happened. I sit here today because of that conversation with cholesterol below 100 and a plan to get diet and exercise under control so that I can see my kids grow up and have their own kids. Because that's how we deal with things in medicine. That's not how they deal with them in DC. So what's the plan? In that news article, what was the idea on how to fix this? What was the solution? Well, there really wasn't one. The only comment about a solution was that if it goes bankrupt, that probably the individuals who provide care, doctors and hospitals, would only get paid part of their agreed upon fee. Part of their agreed upon fee? First of all, it's not an agreed upon fee. It's not like the federal government offers you something, you say, hey, that's good. They tell you what they're going to pay you. And for most doctors and hospitals, that's below cost. So we're going to care for 60 million seniors by just paying part of something that's below cost. Yeah, that's not going to cause any problems. So what should we do? Well, I would offer this advice. First of all, to the media. Hey, I understand that it's sexy and attractive to cover those other stories. I get that you're right now writing away to find out, will the Washington Capitals go to the White House? Will Alex Ovechkin shake the president's hand? Hey, he's Russian. Maybe he's at front for Putin. Maybe he's passing. Damn it, I got caught up in it myself. Okay, write that story. But then write these stories. Do your job. Educate the American people about this before it happens. Do what you're paid to do. And to the politicians in DC, you're the ones who really need to do your job. This isn't about your next election. This isn't about breathing a sigh of relief and saying, ooh, 8 years? Boy, I can get my second term as presidency before that happens, or I can run for re-election in Senate before that happens. No, That's not what this is about. You see, the rest of us view this as a promise that was made to the senior citizens of this country that when they reach those golden years, we will care for them. And unlike you, we think promises are serious things. We don't think they're something to be said on the campaign trail and forgotten about the day after you win the election. So do your job. It's time to get out from underneath your desk, brush yourself off, and be big boys and girls and deal with serious problems. This is a serious issue. It deserves serious people to give serious plans. It's not partisan, and we would like you to stop dealing with it with language like unfunded mandate or discretionary spending. It's none of those things. It's a promise. The American people deserve better, and the physicians who care for them do as well. Do your job. Thank you, and be well.